The first muscle what we are going to see is the sartorius. You can see here, this is the sartorius. So now I am going to isolate this muscle in order to have a clear cut vision of the origin and insertion of the muscle. So now you can see clearly how it takes origin from the ilium and how it gets inserted into the tibia. So first about the origin. It takes its origin from the anterior superior iliac spine, you can see here. So this portion is the anterior superior iliac spine of the ilium. So the sartorius muscle takes its origin from the anterior superior iliac spine of the ilium, and it just crosses the thigh from the lateral side to the medial side. You can see its course. So you can see how it takes its origin and you can follow its course here. And then it gets inserted into the medial condyle of the tibia. You can just note down that this is the lateral condyle and this is the medial condyle. You can see how the sartorius muscle gets inserted into the medial condyle of the tibia. So now coming to the nerve supply of the sartorius muscle. Not only sartorius muscle but all the muscles of the anterior compartment. That is, all the muscles of the anterior compartment they are supplied by the femoral nerve. That is, the femoral nerve has a root value L2 to L4. So all the muscles of the anterior compartment of the thigh, it is supplied by the femoral nerve. Now coming to its action, it is mainly the abductor and lateral rotator of the thigh. Abductor, and then it is the lateral rotator, and it is also a flexor of leg at the knee joint. So these are all the actions of the sartorius muscle. So before moving on into the next muscle, I would like to mention what are all the muscles that are included in the anterior compartment of the thigh. So first we saw about the sartorius muscle. Then there is a group of muscle called quadriceps femoris, which includes 4 muscles, namely the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. And then there is another muscle called the Articularis Genome. So as I already said, this is the sartorius muscle, and here you can see the vastus medialis, and this is the rectus femoris muscle. So if we see under this rectus femoris muscle, we can notice the vastus intermedius muscle. For that purpose, I am just hiding that rectus femoris muscle. So you can see here the vastus intermedialis muscle. And the next muscle is the vastus lateralis. So the next muscle is the Articularis Genome. For that purpose, I am just hiding the vastus intermedius muscle so that you can take a look on the Articularis Genome. So here you can see the Articularis Genome muscle. It is a very small muscle, just taking its origin from the anterior surface of the shaft of the femur and just it gets inserted into the suprapatellar bursa.